Herbal medicine serves to treat diseases, manage pain, and rid the body of other ailments using plants thought to be therapeutic. It is heavily based on empirical evidence, religious beliefs, availability of herbs, and belief regarding health and sickness. Unlike many pharmaceutical drugs used today, certain herbs stimulate immune system response and have a variety of mechanisms of action. It's up to the physician or herbalist to know the effects of each herb and choose which one be best for a particular ailment. Herbs can be mixed with other herbs to create the desired effect and treat multiple symptoms of a sickness. Herbal medicine is one of the oldest treatments for disease going back to prehistoric Paleolithic era. It is practiced by various cultures around the world, including Chinese, Grecian, Roman, Egyptian, and Native American cultures. With no particular culture being responsible for the idea, it was first mentioned in a medical text called Pen Sao by Shen Nung. Roman and Greek physics of medicine coined the term herbalism. Herbalists, such as the Roman and Greek physics, traveled the world to learn more about medicinal effects of herbs. By the 19th century, physicians and herbalists were looking into the ways to isolate the many effects one herb could have, namely opium for the seeds of a poppy. Herbal medicine was used heavily during ancient times as part of traditional Chinese medicine. Considered a modality of traditional Chinese medicine, it's grounded in the ideals of yin and yang. Yin and yang symbolize balance of complementary opposites. When out of balance, illness occurs. The ancient Chinese believed that sickness was an imbalance of qi, an essential structure of the body. Yin and yang can become imbalanced due to excess or insufficient qi. An imbalance of qi can occur if jin lao are blocked. Jin lao are channels from which qi flows in and out of the body. In Western culture, it's referred to as meridians. Based on a particular illness, a Chinese doctor will use various whole herbs and plants to formulate a specific cure. The doctor may take into account presenting symptoms to diagnose the illness or give a treatment targeted to alleviate symptoms.
There are many cures and treatments regarding herbal medicine that we'll talk about in the next slides, but for this slide, herbal treatments are usually made from botanicals, so they're made from plants. So there are different ways that they can be used. So they can be swallowed as a pill, as a powder, or a tincture. And a tincture is just an extract of a plant or an animal, and it's dissolved in ethanol and then applied sublingually. They can also be brewed as tea because a lot of them are leaves. They can be applied externally to the skin as a gel, a lotion, or a cream, and they can also be added to bath water. So the herbal treatments are usually sold as fresh or dry plants, but they are usually not tested or regulated by the FDA, unfortunately. However, they are more accessible and affordable to the general public. So, some common herbal supplements we have are black cohosh, and that's a flower. It's used for menopausal conditions and problems related to menses, so problems such as painful menstruation, uterine spasms, and vaginitis. So, echinacea is a leaf, a stalk, or a root, and it's used to strengthen the immune system. And one of its claims is that it aids in prevention against the cold and the flu. So then we have evening primrose, which is a flower, and it also reduces symptoms of premenstrual syndrome and as well as symptoms of arthritis. So then feverfew is a leaf. It's used to alleviate migraine headaches as well as menstrual cramps. Garlic is a clove or a root, and it's used in the aid of cardiovascular conditions such as high cholesterol and high triglyceride levels associated with the risk of atherosclerosis. So then we have ginkgo biloba, and this is a herb, and it's used for many conditions associated with aging, such as poor circulation and memory loss. So some more common herbal supplements we have are ginseng, which is a root, and this increases overall body tone. It also elevates energy levels and improves people's resistance to stress, meaning they can handle stress better. So then we have golden seal, which is a root or rhizome. Golden seal has healing and antiseptic properties, and it also soothes irritated nasal passages. So it's used for when people have a cold or the flu. So next we have green tea, which is a leaf, and it's used to combat fatigue. It also lowers cholesterol, it aids in weight loss, and prevents arteriosclerosis as well as certain cancers. So then we have hawthorn, which is a fruit. And hawthorn is used for several heart related conditions and is supportive in the treatment of angina, atherosclerosis, heart failure, as well as high blood pressure. So, saw palmetto is a fruit and it's used to treat an enlarged prostate, so men with BPH over the age of 50. So, then we have St. John's wort, which is a flower or a leaf, and it's used for the treatment of mental disorders. It's mainly used for individuals suffering from depression, but there are serious indications that go along with this herbal treatment. And then we have the valerian root, which is a root, and it's used to aid people who suffer from insomnia or just sleeplessness. And then it also aids in the reduction of anxiety. So some
So there are many advantages to taking herbal medicines, including giving the patient a sense of control over their health. This is very important because if patients have a sense of control over their health and feel like they're doing better, like things for themselves in order to better their own health, it can help facilitate healing. Also provides the patient with a sense of well-being through taking these medications and helping themselves. Also, it can be brought over the counter without a prescription. So for patients that might find it difficult to physically go to their doctor, they could easily buy these over the counter. And lastly, it's cost efficient. So for patients that might find it financially difficult in order to buy medications, the average cost per person per month for herbal medicines is $8.58, according to Wanchayan Promplayak. And because of that, it can really ease in the financial hardship that comes with getting prescriptions from doctors. So while there are advantages to herbal medicines, there are also many disadvantages, including certain herbal medicines not being appropriate in certain conditions for certain patients, including patients that might be undergoing chemo or going into surgery. Also, some herbal medicines may be contraindicated if patients are taking other medicines. An example of this is St. John's wort and SSRIs. It's known that St. John's wort can increase the amount of serotonin in addition to SSRIs doing it also, and can make serotonin's levels rise to a dangerous level. Also, because there's a negative stigma surrounding the use of herbal medicines, many patients choose not to disclose to the provider that they're taking them, and that can also increase risk of adverse effects if they are taking herbal medicines and other prescriptions like St. John's wort and SSRIs. And lastly, there's not enough research overall for each medicine out there. And because of that, we never really know what we might be telling patients to try that might be a herbal medicine or the effects that it might have on that patient in the long run. So, in order to best educate our patients as health providers, it's important that we do a couple things before we start educating them. We need to identify our own personal feelings surrounding what we're teaching them. So in this case, it'd be the use of herbal medicines, and then also with the challenge, the stigma surrounding the use of these herbal medicines. And in order to do that, we also have to provide a safe and welcoming environment to the patients to let them know that they can trust us and that we only have like their best interests in mind. And also, when educating patients, it's important to explain the use of herbal medicine may be contraindicated, again, in patients that are undergoing chemo or maybe undergoing surgery. So we have to also take precaution in patients in those conditions. And then lastly, we have to explain possible adverse reactions that may occur if they take this herbal medicine with other prescription medications. Say, like I said before, St. John's wort or SSRIs. We have to really pay attention to that in order to have the patient's best interest in mind.
As healthcare providers, we need to make goals to be culturally competent in the care we provide. An example of a goal is to gain awareness on the patient's usage of herbal medicines to evaluate and maintain patient safety as the patient participates in holistic healthcare treatments. The patients we interact with as healthcare providers are culturally diverse, and we need to have a goal of learning the care that they seek to have greater health, such as herbal medicines. As the awareness on holistic care continues to increase, we must do our part to understand the different types of available herbal medicines, what they are used for, and the contraindications they may have, so that we can keep patient safety our top priority. There are several interventions for evaluating and maintaining patient safety during the use of herbal medicines that we should be aware of. First off, we should ask thorough interview questions when assessing patients. Sometimes patients will leave out information during their interview that they don't find as important, such as the use of herbal medications. Even though herbal medications are not prescribed by providers, they may have harmful interactions with other medications they are taking, so we should always ask specifically if they are using herbal medications and what they use it for, or any side effects or adverse effects that come with it. Another consideration is if a patient is interested in starting to use herbal medicine, but they are seeking more information about herbal medicine. We must be able to provide options that are safe and compatible with the treatments that they are already receiving, and this might be a safer option than them reaching out to find herbal medications on their own without any awareness of the harm they may cause. In today's healthcare system, there are more and more patients that define health in a holistic way. Therefore, it is important to assess and treat patients in a non-judgmental way. As a healthcare provider, even if opinions on the use of herbal medications are controversial, we must support the patients and make sure they receive the education they need to take the medications properly. As always, the number one priority of healthcare providers is patient safety, and we must be the patient's advocate. Lastly, if we are interacting with a patient taking herbal supplements, we should monitor for any complications and the effectiveness of these medications the patient is taking. As a healthcare provider caring for a patient who uses herbal medicines, we must evaluate their patient safety. One way of evaluating their safety is to simply interview the patient. We can have the patient teach back to the provider their knowledge on herbal medications to ensure that they know what the supplement is used for, potential side effects or adverse effects, and how to take the supplement properly. This is more effective than us teaching the patient any knowledge we must have about the herbal medication, because it will show that they are listening and they're doing their part to understand what the herbal medication is. Next, we need to assess the patient's knowledge on the importance of communicating new herbal medications they are taking due to the risk of herbal medication and a prescribed medication not being compatible together. To further evaluate and maintain patient safety, we should provide recommendations to patients who are seeking any assistance in finding an appropriate herbal medicine that they want to take. Lastly, we should continue research on herbal medications to fill the knowledge gap on these supplements that the patients are taking. And this will also show to the patient that we support them and we care about their cultural views on medicine and their way of trying to seek treatment in a holistic way.